They're the best dermatologists I've ever been to because they take time with me. They really take the time to explain, make sure that I understand what the follow-up procedure is if they remove something. He wants to make sure that when I leave here that I understand what happened, I understand what's coming up, if anything, and that the problem has been taken care of.
I've been a patient of this practice for over 16 years. If I had to sum up in one word, it would be thorough.
We can catch atypical lesions at an early stage before they turn into cancer. We can minimize the procedure if we catch it at an early stage. And I'm a big believer on yearly skin cancer exams. You can do a very thorough, detailed examination, complete examination from head to toe. You can combine these things to really find things early.
It's one thing to have a diagnosis, but to be able to get it taken care of in a timely fashion, especially these days, is very important.
There's, so much focus on skin cancer, of course, in the dermatology field, but we see all kinds of skin conditions. We see everything from babies with eczema, rashes of unknown origin, rashes that come from different disease processes within the body. And, there's just so many different things that we can help with.
Once we develop a good relationship with the patients, they understand, and if we can convey the importance of how frequently to see them and what needs to be done, I think they get on board when they know how much you care. I think that makes a big difference as well.
They really care about dealing with the patient on a personal level.
It's pretty much a great relief to not have to worry too much about it, and once I get a couple more of these years with nothing showing up, that's going to be even better.
It's always been a first-class operation here with all their personnel, and I've been coming back for 10 years.
We're very fortunate that we have lots of physicians and lots of technicians to be able to do the total care from a spot that of concern to a biopsy report to the actual surgery, even the high-level Mohs surgery, and then removing that cancer and continuing on with the follow-up care and preventive screenings in the years to come. The patient doesn't have to go to an outside source for any pathology or surgeries that need to be done.
For most surgery, you're removing cancer, so most people are quite appreciative of what we're doing. I love having an internal lab because if I see something that I'm worried about, I can get a slide done immediately.
They don't have to send a lot out anymore, and that's time. And when you've had something cut off of you or out of you and you're concerned about whether or not it's cancer, time takes a long time when you're waiting.
We know that that's the best medicine when you have the clinician and the pathologist, and we even talk about difficult cases routinely with the clinicians, and we talk about different types of treatment options depending on the patient's age and location and tumor type or lesion type. Then we all kind of put our heads together to come up with the best treatment plan.
It's very nice to know that the pathologist is also a dermatologist, the Mohs surgeon is also a dermatologist, so if you're talking to experts, these are them.